Alright, we're going to do imaging facial bones on the trauma patient. Now, because our patient has a neck brace on, patient's not able to do anything for me, they've been injured pretty bad, we're going to work around the patient in order to achieve our reverse waters, our reverse Caldwell, our lateral, and our SMV. So first, for the reverse waters, I'm going to look at the mentomeatal line because that's usually what's perpendicular on the normal patient. And with our trauma patient, our MML line is going like this. So you want to go ahead and angle your tube, which I've already done, to equal this MML line. So it's going to be parallel with this line. Second, our central ray is still going to enter in at the ocanthion. Okay, and then just line up your bucky tray, make sure that is lined up with the tube. I'm going to place my right marker here to indicate this is the right side of her face. So that is the reverse waters. The next I'm going to do the reverse Caldwell. Now usually on a reverse Caldwell we do a 15-degree angle, and that is, keep in mind, is that if our OML is perpendicular, which it is not. What we have perpendicular now is the IOML. So because there is a difference of 7 degrees between these two lines, I'm going to add 7 degrees to my 15. So I'm going to have my tube angle going at 22 degrees cephalad. The central ray is going to enter in at the nasion, and then go ahead and line up your bucky tray so that all that will be in alignment. Next I'm going to do the SMV for the zygomatic arches. So I'm going to pull the x-ray tube down to about a little past midway. It's really closer to the patient's femurs. I'm going to lower it down and then angle the tube so that it's projecting towards the face. Now, when you do the SMV, we're looking at our IOML, and we want the central ray to hit this perpendicular. Now I'm going to give it as close as I can, being that we can only work with her in the neck brace. She cannot throw the chin back. So I'm going to bring her arms down. Let your patient know you do have the x-ray tube close to their body. You don't need to try to bend their knees up. And I'm just going to angle down just a little bit more. This is pretty close to having the central ray perpendicular to the IOML. You know, when you can't always get it exact when you're working with the trauma patient. And I'm going to go ahead and prop this image receptor at the top of her head here. I'm going to go ahead and mark her arches. Now we are getting the right and left arch. So I'm going to go ahead, I have my left marker in my hand, and place it to the left side of her face. Okay. Now we can collimate in so that we don't need a very large area on this, because with the arches we're just wanting this area right here. So I like to collimate where you can, it's like you're cutting off the tip of the nose there, but have it open enough that both sides of the face are included. So that is our SMV. Last, I'm going to do a cross-table lateral of the face in the dorsal-cubitus position. So I'm going to bring the tube out, bring it out to her right side. Now for facial bones, our central ray is going to enter between this outer canthus and the EAM. So we're going for that halfway point. Okay, I'm going to be propping this cassette to her left side. And since this is the left side of her face, I'm going to put the left marker here. And I'm going to go ahead and tape the cassette in place so it does remain upright. And it's usually a good idea to use a grid cassette. I think you get a cleaner picture that way because you are using a little bit more technique. And you can get a decent image using a regular gridless, non-grid. Okay, so this is how we would be getting our cross-table lateral facial bone. Keep in mind we don't have to prop up the back of her occipital area, just for the fact is we're not doing the entire skull. You know, we're just getting the facial bones. If you did prop it up a little bit, that would get it centered to the grid better, but depending on your grid, it doesn't always be necessary. Okay, that's all we have for the trauma patient facial bones.